So before doing your stretches, it's useful to dry the area if possible. Often with a baby or a toddler, it won't be so easy to do this. The mouth's so small. Um, but if it's a child or an adult, certainly see if you can dry the area somewhat. This helps you to be able to get a good grip on the tissues so that you don't just slip off of the tongue. Then get into position, open the mouth as wide as possible. This helps to stretch the tissues underneath the tongue and helps to give good access to underneath the tongue as well. So keep the mouth wide open as you move the tongue backwards and upwards. So you're going to press down to get some grip, and then for around 3 seconds you're going to be pulling that tongue backwards towards the throat and sort of trying to get your fingers underneath the tongue, lifting upwards. Sometimes, particularly if there's been some degree of reattachment, as there was in this particular case that I'm showing, you may need to repeat the stretch to open up the diamond shape. So keep repeating it until you've opened up that diamond. A little bit of bleeding may happen. Don't be alarmed if that happens, it will stop quickly. If this is in an infant or a toddler, particularly helping to, if you feed, feeding will help to stop that bleeding that's there. And if you do the stretches correctly each time, it's rare that there will be reattachment. In this particular case, it was a very severe case on an adult, and where the frenum had gone all the way to the tip of the tongue, so that degree of reattachment that you saw there is quite normal. In this case, we'll see a lip tie that's been treated around 1 week after surgery, and the lip stretch is very similar to the tongue stretch in that you need to pull that lip upwards to stretch that diamond shape and pull to the full range of motion so that you keep that diamond shape nice and open, and also remember to do the brushing across the wound with the finger like I showed you during the consultation and after your treatment.